IAF, National Association of Facilitators. Good afternoon, Sue.
Good afternoon, everyone.
And thank you, Sue, for assisting on moderating the Knowledge Cafe. We're going to start right now. This will be an opportunity for each one of you participants to become speakers, right? So we're going to create 3 series of breakouts with 2-3 participants each. And you have the chance to talk and interact among each other. Sue will give further instructions about this, and we'll reconvene in the end with the panel by our dear co-chairs also joining here today, Professor Rajendra Gupta and Steve McFeely. Thank you so much, dear co-chairs, for joining, as well as a guest panelist for today, Jennifer Punyet. Thank you so much, Jennifer, for having us here. Unfortunately, Eva Aurin is not able to join, so we're going to have 3 panelists in the end. But that said, we're going to have plenty of time for interactions in the Knowledge Cafe. And over to you, Sue.
Okay, thank you very much, Paul. And again, welcome to everybody this afternoon. And yeah, it's good that I think we've had this introductory presentation from Bonnie. Thank you very much. Very informative, very interesting. And it's the chance now for all of us to contribute to this discussion. Let's remember the context we're working in. So this is a preparatory meeting for the Europe-India Digital Health Summit, which is coming up in May, and which will sit alongside the Global Health Assembly. And that itself sits alongside, of course, the WHO, the World Health Organization, meeting to take place in Geneva, where the WHO is based. So, you know, our work this afternoon is going to prepare the ground for that meeting in May. And I suppose what we're thinking about is how we can contribute to that process. What are the issues which are important to us in Europe-India cooperation? And, you know, I know there are representatives here today from Europe, great from the US, other parts of the world, also from India. So what are the issues, you know, that we are thinking about today in terms of digital health, which are going to contribute to discussions at the summit? And we'll issue maybe some recommendations for action. Maybe we're thinking about influencing policy, for instance, government policy. Maybe we're thinking about legal processes, the law. Maybe we're thinking about funding. You know, we're going to be looking for, all of us in the medical world, digital. We look for funding, do we not, to enable us to match our ambitions, both in terms of research and development, and particularly in digital, looking forward, but also in implementation. So, you know, there's a number of areas where we need to think about how we move forward in digital health. And before we go in, Paul, to these groups, I'd just like to recall a number of points that Bonnie made, and 1 or 2 others as well, which are relevant for these discussions and relevant for highlighting these issues, which should be clearly identified and put forward to this summit in May. So Bonnie drew attention to particularly the shortages in funding, shortages in staff, therefore the need for more technology. These points are in no particular order, but stuck out to me as being important. The importance of hybrid care, the use of virtual reality in terms of having virtual nurses or virtual clinicians alongside physical nurses or clinicians, the use of avatars, maybe chatbots, and the importance of remote monitoring today, being able to continuously monitor health, and in a promotion of well-being context as well, a preventative approach, for instance, which, you know, ensures monitoring of health on a continuous basis, both probably healthy people as well as unhealthy people, whatever we mean by unhealthy people. Service robots, the use of robots in the context of administrative tasks, in the context of the elderly, care for the elderly, treatment of documentation, the use of AI to sift all sorts of documentation, all sorts of information coming forward. The use of wearables and sensors, again, the link to virtual reality. And the important point of using technology to enhance the challenges at work, and particularly in this case, the health profession. And then the issue of a broader, more generic issue here, which you might like to think about, and that is, how do we ensure universal care, which is affordable and is quality in the area of digital health, but which also avoids a digital divide, so that we don't have for reasons of finance or reasons of geography, we don't have certain health seekers of health advice and seekers of healthcare going on the one hand being able to access, but then others not being able to access for different reasons. The importance of education, that Bonnie and appropriate education to be provided in terms of preparing for the digital health for the future, but also how learning is undertaken. So the actual use of the technology for healthcare, but also how learning is undertaken. In other words, the technology used to learn. Disease surveillance, data governance. How do we govern data produced in the area of health? What are IPR, intellectual property right considerations here? So yeah, those are really some of the points I think that we could do with working on this afternoon in our groups. And remember, that we are contributing to this health summit, and we are thinking ultimately about how we want to influence the way these technologies develop going forward. Do we have an anchor somewhere? Do we have an anchor technology? Do we have an anchor issue? Is there an anchor stakeholder that we need to make sure is well included and highlighted as an important contributor? And again, in terms of public, because we're talking about public policy here, public activities. Is it policy? Is it legislation? Is it funding? So, Paul, I think I hope I've brought together, and I hope I haven't been too long. I'm sorry.
No.
Or a number of the issues, and maybe what we're pointing to in terms of issues that we recommend, with issues that we highlight this afternoon, which may lead to recommendations later on.
Absolutely. That was a
Thank
great
you.
summary. It's a great summary of Bonnie's starting keynote. And now we're going to open the breakouts group. So you'll be automatically invited to a breakout room. So we are relying here on the technology to randomize your interactions. We're going to have 3 rounds. So hopefully you will be able to talk to each other in the room on a secured environment, like 3-4 participants. You could start to address the questions here Sue raised, and obviously introduce yourselves to each other, because that's part of being here, to know each other as we start this journey towards Geneva in May. And then we are going to send warnings about the time. So you're probably going to complain, oh, it's too short time, but that's part of the Knowledge Cafe method. So it's a series of interactions here. And then in the end, we'll do a wrap up with our guest co-chairs, and acknowledging also Enrique Martins is joining the group. So in the end, we'll do a panel discussion, a brief panel discussion, and we'll finish the planned hour. So without further ado, the floor is now going to be to you in the breakouts. Please accept the invitation for the breakout, as they will be automatically open for you in a randomized manner. You're going to be surprised with whom you find in the room, but that's part of the methodology. Enjoy the Knowledge Cafe.
But also what the skills of those staff will be required. So I guess we're looking at human capital, and is it artificial intelligence or or augmented intelligence? Those are some of the big questions, both for estimates and for the actual practice. Thanks.
Okay, thanks, Steve. Well, there seems to be a quite a dominant theme so far then on data governance, and accessibility and privacy concerns. So that's good in itself. We have an emerging theme that can be taken forward. And finally, I'm going to hand the floor then to Rajendra, Professor Rajendra Gupta from India. I had the privilege. No, is that not correct?
Yeah, Sue, sorry to interrupt, but maybe I forgot to mention that Enrique Martins is also a co-chair, is joining the meeting. So perhaps you pass the floor to Enrique and finally to Rajendra.
Yeah, okay, that's fine. Yes, Eric from OECD, because I was with him just now. Where's Eric?
I think it's a different Eric.
No, it's Enrique, sorry.
It's okay, Sue. Here in Starbucks in
Enrique.
Manila, it's in Starbucks here in Manila. I am Eric, actually. So my name tends to move around the world in different ways and shapes. But you said it very well. It's the origin is French and it's a Portuguese name. Anyway, yeah. Well, I ended up hearing Stephen's report. He was in all my sessions, so I have no further words. But I do add one or two that he mentioned that I want to develop. One has to do with this sort of augmented, or I tend to call it in my sessions, mixed or hybrid intelligence. For me, the big challenge, I like the split between data sharing and data collaboration. I think we should, in the scope of this summit, we should explore this idea. Because many times when you start talking about data between two big blocks, people get nervous. Whereas if we split the word immediately and say, of course, sharing might be an issue, might be interesting, might be on the roadmap, but why don't we just talk about collaboration to start with? Then I think people will lower their defenses. So I wanted to highlight what Stephen said and put it to use for our summit. I liked it, this sort of sharing is one thing, collaborating and sharing how you do it over there, and then maybe we'll do it together one day. And then on this intelligence part, I am now my big passion is how much intelligence can we augment with the artificial one in the humans? Because I've been teaching all sorts of people, students of all sorts, and medical professionals, with nurses and others. And for me, the big challenge for healthcare is, can we use AI to finally have, the best brains back? Because at least in my country, and I think in many countries in the world, we are losing the best brains to other sectors. And I wonder if that's not the biggest threat to the sustainability of the health systems. Is, health systems run by not a good set of brilliant people. We have never had that. That's the only thing I know how to say. We have never had that. We have had always very, very talented people going into healthcare. And that's been changing in the last maybe 10 to 20 years. And I wonder if AI can sort of boost that type of intelligence for more collective. So those are my reflections to add on. Rest, I agree, of course.
Mm-hmm. Thank you, Henrik. Yeah, it just occurs to me, one point you were making there in terms of data sharing or collaboration and the difference between the two, and some nervousness perhaps between between Europe and India. Interestingly enough, one of the groups I was in came up with the idea of a health data agency, an agency which would monitor use of data in the digital health realm. And I suppose if you had more confidence as to the state of play, the baselines, in terms of how you would potentially collaborate or share, that may make trusting each other to be able to collaborate and or share easier, if such an agency were in place, for instance. It's just an idea. It's just an idea.
Yeah, I mean, on that, just a
WHO.
quick reaction on that. One thing that helps is when you know what the other ones interpret as a data agency, right? As a data governance. So one of the things that we've been learning in the EU, in this case more specific, is that when we sort of outline what are the competencies and expected capacities of what are called the digital health agencies, that creates more trust. So if, for example, between the EU and European Union in general, but also European countries that are not from the EU, they know how India and Indian authorities organize their governance, and vice versa, of course, then we are at a better stage to sign sort of bilateral efforts and collaborations and things like that.
Okay. Yeah, that's good. Paul, am I in order now to pass the floor to Professor Rajendra Gupta? Yeah? Okay. Rajendra, the floor is yours. Thank you very much. You're the last. You're going to tie everything up for us today. So look forward to what you have to say.
The best part is everything is said. That only thing will be easiest. But I like the way this entire knowledge cafe was organized. Short, crisp, great discussion with people. I had Sue, I had Louis, I had Elizabeth, I had Lance Prakash with me. Key points discussed. Standards are important. Interoperability without safety is not going to work. We need safety and security. You don't want disparate systems to talk and still expose themselves to, the loopholes. Then what about the organizations and countries with low income? Like what kind of technology you need? You don't need high intent, so maybe conversational AI, the chatbot with AI. So I think very interesting set of discussions, but all should be patient centered. And as I think Steve pointed, WHO is the organization to look at. I'll stop here.
Thank you very much indeed, and I think it remains we're very much on time. Thank you very much for everybody's contributions this afternoon, for speakers, participants, our contributors towards the end. And Paul, I think it's for me now to pass the final word to you before we sign off this afternoon. And just to say from my side, on the basis of these rich discussions this afternoon, I would look forward very much to the next stage and eventually to producing even richer discussions, which hopefully will lead to actionable points in due course associated with this summit that we're going to hold in May. So to you, Paul, thanks very much.
Thank you. Thank you so much for your brave leadership in this moderation and discussions and summary notes. Thank you so much, participants, for joining. I feel honored to have here a group of renowned thought leaders, and there's lots of thought leadership in this group. And believe me, our goal and our intention are that we start as a community towards our side event in May. And then toward our major events happening in Mumbai, the 4th and 5th October, the Global Digital Health Summit, and then our event in Cascais on real-world evidence. This is a joint collaboration between several organizations that are using this side event in Geneva as a springboard event to our conversations. And hopefully, if this is successful, thanks to our supporters, we can have a community that will keep on year after year, because the WHA is a major health event, and digital health needs to find more and more space in that conversation days in Geneva. Thankful, obviously, to Steve McFeely, Director of Data Analytics WHO, for being here and supporting this with his leadership and presence. Thank you also, Jennifer, for your support here. We look forward to have you also in Geneva in May. Thank you, dear participants. And as I said, Enrique is back with the video on. Enrique, thank you for joining us from Manila. And so a conversation will start. You will receive a calendar invitation for exactly 1 month, and we'll see how we are progressing with our notes or discussions. Oh, I also need to acknowledge here someone really, and I think bring to the spotlight here, Caroline Perrine from GD Hub, which has kindly offered a beautiful space on the Tech Hub in Geneva. We're going to have physical space to meet on Wednesday 29. This is going to be a major update. So Caroline and GD Hub, we are so thankful to you and to your inputs. Perhaps even you like to give us 30 seconds?
Sure. Hello to everyone I haven't met. I think I had different people in every room, so I met most of you. As mentioned, so we are organizing on the 30th of May a day that's called Geneva Digital Health Day, where we will have 5 blocks with different thematic areas. And we are also trying to integrate some of the discussions we will have the day before in this day. But this day has been organized since a long time. There are a lot of different organizations participating. And then we have, so on the 29th, we have still space in one of the rooms at Campus Biotech that has a capacity of around 70 people to host a get-together for the summit. So as most of you know, WHA is very busy in Geneva. I have the feeling this year it's even busier than the other years because there's a lot of different big events happening, the Research Forum, AI for Good, and so on. So it's not so easy to find a bigger space, but we hope that this will help to kind of bring the group together and start the summit.
Thank you so much, Caroline. So goodbye, everyone. I will kindly ask co-chairs to stay a little bit for the briefing as agreed, and then we'll see each other in a month virtually. Thank you all for joining.
Bye, everyone.
Bye,
Thank you very
everybody.
much.
Bye-bye.
Thank you.
Bye, Sue. Bye.